Welcome to Facts TV News, where everything is true. 10 years old die after consuming beverage in St. Anne, another in hospital. A 10-year-old child died on Monday after consuming what is said to have been a beverage that was purchased in Discovery Bay, St. Anne on the weekend. Another child, who also consumed the beverage, has been hospitalized. The deceased has been identified as Richard Emmanuel of a Discovery Bay address. According to newly appointed head of the St. Anne Police, Superintendent Dwight Powell, a death investigation has been launched into the suspected poisoning. The children were a part of a church group that reportedly purchased the beverage on Saturday. The information that the police have is that two youngsters who were part of a church team may have purchased beverages from a local businesswoman who distributes Irish moss, among other juice, said Powell in an interview. He further stated that after consuming the beverage, persons complained of stomach ailments, vomiting, and diarrhea. One of the youngsters, a 10-year-old, died en route to hospital about 2 days after consuming the substance, Powell added, noting that another child remains hospitalized. None of the other persons who consumed the substance have been hospitalized so far, the senior lawman indicated. Investigations continue into the incident. 3 more COVID-19 deaths, 88 new cases. 3 more people have died from COVID-19, increasing the number of fatalities to 342. The deceased are an 82-year-old male from St. Anne, an 88-year-old male from St. Elizabeth whose death was formerly under investigation, and an 87-year-old male from Kingston and St. Andrew. His death was also previously under investigation. One more case was recorded as a coincidental death. This case was previously under investigation. There were 88 new cases of the disease in the last 24 hours, with ages ranging from 1 to 90 years. Pushing Jamaica's total COVID-19 cases since March 10 to 15,241. Of those cases, 2,781 are active. Of the new cases, 46 are males and 42 are females. In the meantime, there were 31 more recoveries, including the total to 11,942. Some 100 persons are in hospital, with 8 being moderately ill and 11 critically ill. COVID break, Prime Minister relaxes restrictions but warns of pullback if rules broken. Days after tighter strictures were placed on Manchester to contain the worrying spike in COVID-19 numbers, some areas of national life are being given a reprieve following intense lobbying. Effective February 1, churches will have the green light to host funerals. According to Prime Minister Andrew Holness, up to 10 family members will be accommodated and up to 5 religious leaders can attend the funeral. We are not allowing mass opening-end funerals, regardless of how large the church is. The same rule that is applied at the graveside will be the same rule that is applied in the church. Holness told Parliament on Tuesday, adding that the measures would be in effect for 1 month before it is reviewed. He said the measure would be shut down if non-compliance is detected. Holness maintained that his administration was trying to balance managing the pandemic while making provisions for social rituals. For public passenger buses, Holness said they will be allowed of a limited number of standing passengers based on the seating capacity of the bus. He said for a common 30-seater, 6 persons could be allowed standing room. Holness said Cabinet has made provisions for sporting events to take place, but only with approvals. Opposition leader Mark Golding noted that the Jamaica Premier League was already making strides in securing millions of dollars in sponsorship for local soccer's premier competition. This is not just about sports. For many of these people, this is about their livelihood and their family's livelihood. And of course, all around it, there is an economy. It is similar to entertainment, said Golding, who is chairman of the Arnett Gardens Football Club. Holness said the relevant ministries would be meeting to review proposal on the reopening of the entertainment sector. Jamaica has so far recorded 15,153 cases of corona infection. 339 persons have died as a result of the disease. Sporting events to resume, says Holness. The Jamaican cabinet has agreed that sporting events can resume, but under certain conditions. These include having no spectators inside sports venues once the green light is given for a formal resumption of sports on the island. Prime Minister Andrew Holness made the announcement Tuesday in the House of Representatives, where he provided an update on the government's response to the COVID-19 pandemic. All sporting activities ceased shortly after Jamaica confirmed its first case of COVID-19 on March 10, 2020. Holness said the Ministries of Sports, Health and Local Government will in due course provide more details about the conditions under which sporting activities will be allowed to take place. However, until more details are provided, Holness stressed that this is not a wild-scale return to sports. We have to first of all go through a process where we look at each sporting event and what they require and the specific public health protocols that can be put in place to ensure that they are safe. He said the organizers of each sporting event will have to apply for approval for their event to be held. We've seen various models and modalities where this can be done, and we believe we can do them in Jamaica, said the Prime Minister, who acknowledged that the country's athletes have recently suffered. I can imagine how dejected they would feel. No World Cup, no Olympics. They've trained for a long time, but we're going to find a way to get them back on the field, to get them back on the track and get sporting events going, Holness promised. The Prime Minister stressed that it may be that in the first instance, these sporting events will have to take place without spectators. This will also apply when they are training as well. It's the bubble concept that will apply, he said. More schools reopening in Region 4. Regional Director in the Ministry of Education, Youth and Information, Dr. Michelle Pinnock, says by the end of this week, a total of 34 schools should be reopened for a mix to face-to-face and remote learning in Region 4. The region covers Hanover, St. James, and Westmoreland. According to Pinnock, as of Friday, January 22nd, there were 27 schools in the region employing face-to-face instructions and remote learning. She noted that the primary school students in grades 4 to 6 who are slated to sit the upcoming PEP examinations will have part in the face-to-face lessons. Pinnock stressed that the Education Ministry has been working in tandem with the Ministry of Health every step of the way to ensure the safe reopening of the schools in the region. We partner well with the Ministry of Health. We are in contact with the persons in charge of each of the parishes, and I try to keep them abreast as to what is happening. So we have a great partnership going, she said. She added, the public health inspectors are in the schools daily, and the health promotion officers are also in the schools working with the teachers, doing sessions with the students. So the partnership is there, and they make sure that they evaluate us on a continuous basis to see how it is that we are doing with the protocols. They go into our schools announced and unannounced, so they give us the feedback. They ensure that we follow the different protocols. The regional director said that prior to a school reopening in the region, the ministry must first complete two important pieces of documentation. The first document speaks to logistics and determine how many students can be in the classrooms and elsewhere on the school premises in adherence to social distancing protocol. The second document is the 10-point implementation plan of what is expected of the school when they reopen. Meetings are held with parents to discuss the plan prior to the reopening of a school in the region. She stated that the region has a feedback system which involves reopening schools giving a weekly report to the ministry about any issue that may arise during that week. Pinnock further noted that the region takes the blended approach to learning seriously as it promotes independent learning among students. We are trying to promote self-discipline as it relates to their schoolwork, so we are not just taking them back into the school setting face-to-face for them to complete a syllabus. We are taking them in to also get the attitude of becoming independent learners, she said. Several schools across the island resumed face-to-face learning on January 11, 2021. Richmond Bridge woes linger as collapse widens. The gaping hole in the bridge that connects the major communities of Richmond and Highgate in St. Mary has more than doubled its size since it last collapsed 8 months ago. Residents have renewed desperate pleas for the structure to be repaired, even as they endanger their lives daily. In April last year, they complained of hiked fares and back-breaking pressure carrying loads across a partially collapsed bridge that was close to vehicular traffic. Last Friday, the scene was quite the contrast. No taxis were loading on either side of the bridge, nor was there caution tape warning road users of the hazard. More than a dozen vehicles, including a truck and few taxis, passed within the first 10 minutes of the news team visiting the area. Jason Clark, a resident of Richmond, shared that since the bridge was damaged, he has been driving along the alternative route or extending traffic time by 30 minutes when he journeys to Port Maria for work. Not to mention the fluid costs and the wear and tear of the vehicle, because those two routes are in a deplorable condition. They are fords in it, so when it rains, I can't get to work, he added. Clark explained that it was the only route that has a bridge, which makes it viable for commuting in the community. Frustrated with the increased spending of transportation, he said that residents took it upon themselves to remove the heaps of dirt and stone blocking vehicular traffic and began traversing the bridge. We are desperately asking for help for this bridge to be fixed. They came in with some heavy equipment and started some work, then those equipment left, so we don't know what's happening in terms of the construction, he added. Clark drives across the broken bridge 10 minutes a week to and from work and admit that it is a risk, but compared to the wear and tear of the vehicle and the time, it's worth taking. A taxi driver revealed that it has been about 6 months since he and other motorists began crossing the bridge. I have to pass here so about 10 times a day. What me really want to happen right now are the bridge fix, cause it is an essential road for everybody, he appealed. Another Richmond resident, Kemar Grant, shared that he drove over the bridge on Friday, the first time in several months, but is concerned about his safety. The bridge can collapse at any time. The bridge needs to fix, cause I know everybody can afford the extra taxi fare, Grant lamented. National Works Agency Communication and Customer Service Manager Stephen Shaw said that there are still inherent dangers at the location. The agency has underpinned a section of the embankment that had failed at a cost of $19 million. A date has not been set for the second phase of work as it is being costed based on a recently completed design. Shaw closed by saying the NWA is now seeking to alter the design of the infrastructure. Please remember to subscribe, like, share, and click the notification bell for daily updates.